So today we're talking about big entertainment news that Billy Joel canceled some of his upcoming concerts because of a recent diagnosis of normal pressure hydrocephalus. So what is normal pressure hydrocephalus? Well, another name for it is NPH, and it's a type of communicating hydrocephalus, meaning that the cerebrospinal fluid spaces in the brain still communicate, that results in enlargement of the fluid-filled spaces in the brain or the ventricles. Now, typically the term normal pressure hydrocephalus is actually considered a misnomer because when you measure pressure in cases of NPH, you actually see elevated spikes of pressure in NPH as well. And the net result thought of the cause of NPH is thought to be related to the arachnoid granulations, which are the areas of the brain that reabsorb cerebrospinal fluid, not functioning properly. And this tends to happen in patients as they get older. And so you see this disease commonly in patients later on in life, particularly in their 80s and beyond. So the classic triad for NPH is a mnemonic that we learned in medical school called wacky, wobbly, and wet. And so the symptoms patients have is that they have ongoing memory loss or dementia, symptoms like dementia, they have gait disturbance or wobbly gait, and they have urinary incontinence. And from a surgical standpoint, the critical thing about NPH is making sure you have the correct diagnosis. And a lot of times what you like to do in these cases, you do provocative testing or a high volume lumbar puncture where you drain out spinal fluid and you see if the patient's symptoms get better. Usually in cases of NPH, you see a temporary improvement. And in cases where you do see a clear improvement, the treatment is usually a procedure called a shunt, where we place a catheter into a patient's brain to divert the CSF from the brain to the stomach or another organ. As you can see in the video here, the shunts nowadays we use neuronavigation so they can be extremely accurate. And as you can see, a lot of times you can get great CSF flow. In this case, you can see actually under some pressure, and patients can have significant improvements after shunts. The one thing to be cautioned about is that when the diagnosis is not made properly, patients may not have an improvement. The other thing is over-shunting can cause problems. It can cause rapid shrinkage of the brain and can cause bleeds and other things. So the diagnosis is absolutely critical, and in cases where the diagnosis is made properly, a shunt can be extremely beneficial.